Aboriginal and Torres Strait Islander health workers are critical to closing the health gap. They are an integral part of the healthcare team, and it's vital that their skills are used to the fullest. The Northern Territory has the highest proportion of Aboriginal and Torres Strait Islander people for any state or territory in Australia. The Royal Darwin Hospital is the largest teaching hospital in the Northern Territory. So the role of Aboriginal health workers within the hospital is crucial. They use their clinical knowledge to improve health literacy of Aboriginal patients and the cultural sensitivity of the mainstream hospital environment.
Working with Aboriginal health workers in the Territory is just embedded in our practice. We have Aboriginal health workers in the hospital who assist us with day-to-day routine management of patients. And we also, when we do remote community work, we work with Aboriginal health workers again. So they're just very much part of our ordinary daily routine.
You get them to pump the hand, that one that stays one place and it's nice and spongy.
These are people with very specific medical training. They have to do courses. They get valid academic diplomas issued by accredited training institutions. But as well as that health knowledge, they have unique insight into the life of Indigenous people and all the complexities that Indigenous people have to deal with. These are very extraordinary people. They are part of our team.
Hello, Melissa. Would you like to come in? I've been a health worker for 12 years and been with the diabetes team for the past 10 years off and on. Melissa, did you bring your book with you? Can I have a look, please? I've been working here with the Diabetes and High-Risk Antenatal Clinic for 6 years, and there's a big need, and if you've got the skill to get that message out, it's good. And it's good for the mums and bubs at the end of the day, healthier outcomes. As I say to my patients, life's too hard to be sick.
Clinics at remote communities don't always run very smoothly, but this particular clinic ran extremely well because there was this lady called Samara at the front desk who had everything well organised, had the patients well organised. We were quite impressed. We had a wonderful day. At the end of the clinic, the lady who we now knew as Sumaria approached us and said, "I want to work with you guys, can you get me a job?" And on the spur of the moment we said, "Sure, we will."
And how's everything been?
Fine.
How's the weekend?
So my weekend is good.
Diabetes is a silent disease, and we have to start talking about it. And the families need to talk within their families for the next generations. How did you feel when you had that low?
I was just feel hungry and I had a late dinner.
Yep. So I give them information package and I tell them to take it home and talk to the family. Okay.
Lunch, dinner.
Yep. But you've been doing really well. That's why I'm passionate about diabetes in pregnancy. Because a lot of the patients we're educating now, the boat's gone. So we have to educate the younger generation. I'll just check your blood sugar now.
Samara's unique skills of communicating extremely directly with Indigenous patients absolutely floored us at the beginning. I remember we were just stunned and realised how incompetent we'd been, and we learned a lot from that.
Always do it on the side of your finger.
The Indigenous patients enjoy the fact that this is another Indigenous person, and she speaks very directly to them. So even our patients who may not have good command of English always have some English.
Just put pressure.
So she knows how to translate our English into the sort of language that they can understand.
6.9, that's really good. Do you think that's in target?
Mm-hmm.
Okay, so we'll just put it here, 6.9.
And also I just want to know which one the number is high.
Anything over 7 millimoles, okay? Your target is between 4 to 7.
What's been a revelation to us is she also, as a team member, works with all our patients, which obviously includes non-Indigenous patients, and she's very good at that too. It's not Samara, the Indigenous Aboriginal health worker who works as a diabetes educator, it's Samara, the diabetes educator.
Aboriginal health workers can talk to the patient and understand where they're at. We're more cultural brokers. We can simplify procedures in layman terms, and also we've got the medical terminology as well. So we understand both sides. I educate them in a way that empowers them to make a change in their life for better health outcomes. Hello, Sandra. How are you feeling? Yeah. What happened? You run out of insulin? And how long you'd never took your insulin for? I speak to them in plain English, a couple of days. Instead of them getting baffled by medical jargon, I simplify a lot of my information at their level, and I can communicate with the doctors, the specialists, and advocate for the patient as well. So that helps. And like, if my patient says, I don't understand him, I'll interpret it back to him at an easier pace and in plain English. Has the doctor come and seen you yet? Yeah. Yeah, what did he say? You don't know, okay. Everything's good with baby, and who's looking after him?
Well, Samara was a groundbreaker, and she's presented at national conferences in relation to diabetes, and our colleagues from down south are very much impressed by what she's able to contribute and how well she can undertake a presentation at a national conference and communicate there as well. So you've got very broad-based skills.
I'll see you tomorrow morning, and I'll come and have a talk, okay? Okay, ta-da. Because I work in an acute setting, we have to be multi-skilled, and I'm the only health worker specialising in diabetes. I'm the first Aboriginal health worker trained in hyperbaric, and that's working with diabetic ulcers that don't heal, so we give oxygen therapy. So I've done a lot of wound care. We're going down. Just push that flap. To actually take on the role as wound nurse is through education. Is that too tight? You can't help the patient if you've got no qualifications, because no one will give you a piece of paper. You have to earn it. Have you measured his neck? We can try that, yeah. You have to believe in yourself and being a good role model as well. This is going over to your head, like putting your shirt on. I'll go to this other side. I've been to nearly every community in the top end, and you learn to pick up on different beliefs. That's it. Different languages, different surnames. So if you hear a surname, you know where they're from. And the easiest way I build up rapport, I can say to that patient, oh, I've been there, and automatically they're your friend. So it's that way of communicating that is appropriate, and they know you've been to their community, and that's really special. And I think over years you learn to listen, and that way you're better at communicating. Yes, you put this one on, okay?
Just show you what it feels like.
Okay, and a lot of people can read and watch movies, Mark. That all right? That's comfortable, isn't it?
I've just had a remarkable experience where a couple from urban Melbourne had to learn how to manage diabetes that required insulin, and they were waxing eloquent to me about the wonderful diabetes educator who had assisted them and provided with material that they could use as they wound their way around the country on their trip. And I said, oh, who was it? And they said, oh, Samara, she's fantastic.
I got to take one now because I didn't have any last night.
Oh, that's much better. Becoming a health worker is really important because you're working with your people and you can make a difference to your family, friends, and it's our backyard. And at the end of the day, the doctors and nurses fly out. You're booked in for Friday's clinic, eh?
Yeah.
Now there's so many training opportunities for Indigenous people, you can do whatever you want, but it's up to the individual. But it is a good career.